What if that swelling in your legs and ankles isn't just something to brush off as getting older, but an early signal your body has been quietly sending for years? A signal that something deeper may not be working as smoothly as it should. Because for many people, this kind of swelling doesn't appear overnight. It builds slowly, subtly, until one day your shoes feel tighter, your legs feel heavier, and simple movements don't feel the same anymore. And the concerning part is, most people ignore it in the beginning. They assume it's harmless, temporary, normal. But in some cases, it can be your body's way of hinting that circulation may be slowing down, that fluid balance may be shifting, or that your system is under more strain than it should be. And if left unaddressed, it doesn't just stay as swelling. It can begin to affect your comfort, your mobility, and your overall quality of life. Which raises an important question. What is your body really trying to tell you? And more importantly, what can you start doing about it before it goes further? And once you start noticing those small changes, it's important to understand what they may actually mean beneath the surface. Because swelling in the legs and ankles is often dismissed as a normal part of aging, but in many cases, it's one of the earliest signs that circulation may be starting to slow down. It doesn't usually come with a warning that feels urgent. Instead, it begins quietly. You might notice your shoes feeling tighter by the end of the day, even though they fit perfectly in the morning. You may see faint marks left behind by your socks pressing into the skin. Or there's that subtle heaviness in your legs, a tired, dragging sensation that wasn't there before. At first, it doesn't hurt, and that's exactly why so many people ignore it. There's no sharp pain demanding attention, no immediate disruption forcing you to stop, so it's easy to assume it's harmless, something temporary, something that will pass on its own. But over time, these small signals can begin to add up. As circulation continues to slow, the fluid buildup can become more noticeable. Your legs may start to feel less stable. Movements that once felt effortless may require more caution. Even simple things like walking across a room or standing for a while can begin to feel different. And gradually, this doesn't just stay about swelling anymore. It can begin to affect your balance, your confidence when walking, and even your sense of independence in daily life. Which is why catching these early signs and understanding what your body may be trying to communicate can make a meaningful difference before it progresses further. And that leads to the next important piece. What's actually causing this to happen in the first place? And once you understand what the swelling might be signaling, the next question becomes even more important. What's actually causing it? Because most people immediately jump to serious explanations, thinking it must be the heart, the kidneys, or maybe too much salt in the diet. And while those factors can play a role in some cases, they're not always the main reason this kind of swelling begins. In fact, one of the most commonly overlooked causes is something much simpler and much more common: reduced movement. You see, your body isn't designed to keep fluids moving on its own without help. It relies heavily on motion, especially from your muscles and joints, to keep circulation flowing properly. Every time you walk, shift your weight, or even gently move your legs, your muscles act like a natural pump. They help push blood and fluid back upward against gravity toward the heart. At the same time, your joints, especially in the ankles and knees, help keep that flow smooth and continuous. But when movement decreases, that system begins to slow down. Long periods of sitting, whether it's watching TV, working, or simply resting more than usual, allow fluid to gradually settle in the lower parts of the body. And without enough muscle activity to push it back up, it starts to collect in the legs and ankles. Over time, this can weaken that natural pumping system. The muscles become less active, circulation becomes less efficient, and what started as occasional swelling can slowly become more frequent, more noticeable, and harder to ignore. So in many cases, the issue isn't just what's happening inside your body, it's what your body is no longer being asked to do, which makes the next part especially important.
Because if reduced movement is part of the problem, then small, targeted movements may be one of the simplest ways to start supporting your body again.
And once that connection becomes clear, it naturally leads to a powerful realization. Movement may matter far more than most people expect. Because in many cases, the body isn't necessarily lacking treatment, it's lacking motion. It's easy to assume that circulation is controlled only by internal organs, but a large part of that process depends on something much more active, your muscles. Every step you take, every shift in position, every small movement in your legs helps keep blood and fluid moving the way it should. Without that regular activity, the entire system begins to slow down. When movement becomes limited, fluid doesn't circulate as efficiently. It starts to linger, to settle, and eventually to pool in the lower parts of the body. At the same time, the body's natural drainage system becomes less effective, simply because it isn't being activated often enough.
Now, medications can sometimes help manage symptoms, and in certain situations, they play an important role. But they don't replace the mechanical process your body relies on every day. They may support the system, but they don't fully replicate the effect of consistent movement. And that's where the real shift in thinking happens. The goal isn't to push your body beyond its limits or force intense activity. It's much simpler than that. It's about gently reactivating what already exists, reminding your body how to move fluid, how to support circulation, and how to use the systems it was designed with.
Because sometimes the most effective support doesn't come from adding something new, but from restoring something that's been quietly fading over time. And that brings us to the most practical part, how to start reintroducing that movement in a way that feels safe, simple, and sustainable.
Movement 1, and now that you understand how important movement really is, let's move into something practical, because this is where small actions can start making a noticeable difference. One of the simplest and most effective movements you can begin with is the heel raise, often called your body's natural pump. This movement directly activates the calf muscles, which play a major role in pushing blood and fluid back up from the lower legs toward the heart. In fact, every time these muscles contract, they help move fluid against gravity, something your body cannot do efficiently without that mechanical support. The best part is, this doesn't require standing, effort, or strain. You can do it while sitting comfortably. Simply sit upright with your feet flat on the floor, then slowly lift your heels while keeping your toes grounded. Hold that position for about 2 to 3 seconds, then gently lower your heels back down. The key here isn't speed, it's control. Moving slowly allows the muscles to fully engage and do their job properly.
If you're just starting, aim for about 10 repetitions, and as it begins to feel easier, you can gradually build up to 20. There's no need to rush this process. What matters more is consistency than intensity. A great time to do this is right after periods of sitting, like watching television, after a meal, or even during a long phone call. These are the exact moments when fluid tends to settle, so activating your muscles during or after these times can help counter that effect. And one important detail many people overlook: avoid doing this quickly or mindlessly. Fast movements reduce the effectiveness. Slow, controlled raises allow your calf muscles to fully contract and release, which is what creates that gentle pumping action your circulation depends on.
It may seem simple, almost too simple, but this kind of movement is exactly how you begin reawakening your body's natural flow, one small step at a time. And once this becomes comfortable, there's another movement that builds on this effect in a slightly different way.
And once you've started activating the lower legs with heel raises, the next step is to bring in a slightly larger movement, one that reaches deeper into the system and supports circulation on a broader level. Seated marching is a simple but powerful way to create what you might think of as a deeper circulation reset. Unlike heel raises, which mainly target the calves, this movement engages the larger muscles in your thighs. These muscles play an even bigger role in helping push blood and fluid upward, especially after long periods of sitting when that heavy legs feeling tends to build. What makes this movement especially helpful is how naturally it fits into your day. You don't need any special setup. Just sit upright in a stable chair, Keep your posture relaxed but supported, and slowly lift one knee upward. Then gently lower it back down and switch to the other leg, alternating in a slow, controlled marching motion.
The key here isn't speed or intensity. It's steady, deliberate movement. When you move slowly, the muscles engage more fully, which helps improve circulation more effectively than quick, rushed motions. Think of it as waking the muscles up, rather than pushing them hard. To begin, even 30 to 60 seconds is enough. It may not sound like much, but when done consistently, especially during or after long sitting periods, like watching TV, scrolling on your phone, or after meals, it can make a noticeable difference in how your legs feel. Over time, this gentle activation of the thigh muscles helps reduce that sense of heaviness and sluggishness. It supports the body's natural ability to move fluid upward and prevents it from lingering in the lower legs for too long. And as this movement starts to feel more natural, you'll likely notice something important. It's not about doing more, it's about doing just enough, consistently, to remind your body how to keep things flowing. And from here, we can build even further with another simple movement that adds a different kind of support to this process. Movement 3. And as you begin to activate both the calves and thighs, there's one more area that often gets overlooked, but can make a meaningful difference, especially during long periods of inactivity. This next movement focuses on the feet and ankles, where circulation can slow down the most. Toe flex and point may seem simple, but it helps activate the smaller pathways that support fluid movement in these lower areas. When these pathways stay inactive for too long, like in the early morning or before bed, fluid tends to settle, leading to stiffness, discomfort, or even cramping. To do this, sit or lie down in a comfortable position and extend your legs slightly. Then slowly point your toes forward. Hold that position briefly, and gently pull them back toward you. This forward and back motion creates a subtle but effective activation through the feet and ankles. The key, once again, is to keep the movement slow and controlled, allowing the muscles and joints to fully engage. Aim for about 15 to 20 repetitions, moving with intention rather than speed. It's not about how fast you complete the motion, but how well you feel each phase of it. This helps improve awareness in your feet, which can play an important role in maintaining balance and stability over time. Beyond circulation, this movement can also help reduce stiffness that builds up during inactivity and may lower the chances of those sudden cramps that sometimes occur when the muscles haven't been used enough. It's a small action, but in areas where movement is often the least, even small actions can have a noticeable impact. And when you combine this with the other movements, you begin creating a simple, consistent routine that supports your body from the ground up, helping it stay active, responsive, and more balanced throughout the day. Movement 4. And as you continue building this simple routine, the next step focuses on something that often gets overlooked with time: joint mobility, especially around the ankles. Because as we age, the ankles tend to become stiffer, and that stiffness can quietly interfere with circulation. When the joint isn't moving freely, fluid can start to feel stuck around that area, making swelling more noticeable and movement feel heavier than it should. That's where ankle circles come in. This movement is designed to gently unlock that stiffness and restore a smoother flow. To do it, simply lift one foot slightly off the ground while sitting and begin rotating your ankle in slow, full circles. Take your time with each rotation, allowing the joint to move through its complete range. Aim for about 10 circles in one direction, then switch and do 10 in the opposite direction. What matters most here isn't how many you do, but how you do them. Smooth, controlled circles are far more effective than rushed or partial movements. When done properly, this helps re-engage the joint, improves mobility, and encourages fluid to move more freely instead of lingering around the ankles. This movement can be especially helpful at two key times: first thing in the morning, before you even stand up, when stiffness tends to be higher, and later in the day or evening, when swelling may start to build after hours of sitting or standing. Over time, regularly including ankle circles can help reduce that tight, restricted feeling and make movement feel more natural again. And when you combine this with the other movements, you're not just addressing one part of the problem, you're supporting your entire lower body circulation system in a simple, consistent way that your body can respond to.
Movement point 5. And after activating circulation through movement, the final step brings everything together in the simplest possible way, by using gravity itself to support your body's natural drainage system. This is where leg elevation becomes especially powerful. Unlike the other movements that actively engage muscles, this one allows your body to rest while still working in your favor. The idea is simple. When you lie down and raise your legs higher than your heart, gravity helps guide excess fluid away from the lower legs and back towards circulation. It's one of the easiest yet most effective ways to reduce that end-of-day heaviness. To do it, lie comfortably on your back and gently raise your legs up against a wall. You don't need to force the position or keep them perfectly straight, just enough elevation to allow gravity to assist the flow. Stay in this position for about 5 to 10 minutes, breathing normally and allowing your body to relax.
If a wall position feels uncomfortable, you can use pillows under your legs instead. The goal is not perfection, it's comfort and consistency. This is best done at the end of the day, especially when swelling tends to build up after long periods of sitting, standing, or general activity. It acts almost like a reset for your lower body, giving your circulation system a chance to recover. Over time, many people notice a sense of lightness in the legs, along with reduced pressure and visible swelling. It's not an instant change, but a gradual response that builds with consistency. And when combined with the earlier movements, this final step completes a simple but structured routine, one that supports circulation from activation to release, helping the body maintain a more balanced and comfortable state throughout the day. And when these early signals are ignored for too long, the changes don't just stay mild or occasional. They often begin to become more persistent and noticeable in daily life. What starts as occasional swelling can turn into something that appears more frequently, especially toward the end of the day or after even short periods of sitting or standing. The legs may begin to feel consistently heavier, more tired, and less responsive than before, as if they are carrying extra weight that wasn't there previously. Over time, this can also start to affect how confidently you move. Simple activities like walking, standing up, or changing direction may not feel as stable or effortless as they once did. The body begins to adjust to reduced efficiency in circulation, and that can gradually influence overall mobility.
As the pattern continues, more visible and physical changes can appear. The skin around the lower legs may start to look different, sometimes tighter or slightly stretched due to repeated fluid buildup. Stiffness can also become more noticeable, especially after periods of rest. And perhaps most importantly, when these changes progress, they can slowly begin to affect independence in daily life. Tasks that once felt simple may require more effort, more caution, or more rest in between. This is why early awareness matters so much, not because of fear, but because small signals are often the body's way of asking for attention before the changes become harder to reverse or manage. And understanding that opens the door to taking action earlier, while the body is still highly responsive to simple, consistent habits.
And once you understand each movement on its own, the real benefit comes when you start combining them into a simple, realistic routine that fits naturally into your day. Because the goal here is not to create something complicated or time-consuming, but to build small moments of movement into the parts of your day where your body needs them the most. After sitting for a while, whether it's watching TV, working, or just resting, heel raises become a simple way to reactivate circulation in the lower legs. It helps wake up the calf muscles and get fluid moving again after being still for too long. In the morning or before bed, ankle circles combined with toe flex and point movements help restore joint mobility and gently activate the smaller muscles and pathways in the feet. This is especially important at the start and end of the day, when stiffness tends to be more noticeable. During the day, especially in longer sitting periods, seated marching adds another layer of support by engaging the larger thigh muscles. This helps keep circulation active when your body would otherwise stay still for too long. And finally, in the evening, leg elevation allows everything to settle and reset. By simply giving your legs a raised position, you're letting gravity assist your body in naturally reducing pressure and supporting fluid drainage after a full day of activity. When you look at it as a whole, this isn't about doing everything perfectly or following a strict routine. It's about staying consistent with small actions that support your body throughout the day in a way that feels manageable and sustainable. Because in the end, progress doesn't come from intensity. It comes from consistency over perfection, repeated day after day, until these small habits start to feel like a natural part of how your body is cared for.
Before you move on, ask yourself, what's the one movement you'll start today? Comment 1 if you're committing to try even one, and share this with someone dealing with heavy or swollen legs. Small daily habits can create real change over time.